What's going on, everyone? Welcome to the Wednesday edition of the Pandemic Update for the United States for Wednesday, May 10th, 2023. Today is kind of a somber day. You almost want to say a depressing day. Not so much depressing, but it's the last day before the pandemic ends. And the reason why that might be depressing, because you still have a lot of people that are testing positive for COVID in the hospital. You still have a lot of deaths, and the resources needed to cope with that are coming to an end because the pandemic emergency officially ends tomorrow on Thursday, May 11th, which it may not look to you at all like the pandemic's ending after we get through this video. As you see in my video every day, there's always, constantly, still endless number of things that are going on that, in my opinion, still justify for there to be a pandemic emergency, such as this. Flint moves customer service center after employees test positive for COVID-19. This is up in Flint, Michigan. Now, you're going to see some advertisements on some of these sites. I have to compromise here at some point. Some articles I could not even see because I had an ad blocker on, which was working for the most part. And then I couldn't get to some news stories, and it was getting frustrating. So, in some instances, you're going to have to see ads. And in other cases, you won't see ads. Alrighty. Flint, Michigan. Let's read a little bit of this. The city of Flint has shifted its customer service center operations from a first-floor office to a walk-up window outside City Hall after 2 employees in the office tested positive for COVID-19. City officials announced the move in a news release on Tuesday, May 9th, saying they were taking the action out of an abundance of caution and that additional employees in the area have been tested and work areas have been disinfected. Remember, this is an airborne pandemic, so why we're not mentioning that it's airborne is beyond me. Alright, let's move on to our next story. Now, this is international. We didn't include this in the international update. Didn't actually have time to, but this is over in Thailand, and Thailand is bringing back some COVID measures, such as masking. As you can see here, yeah, does that look anything like the end of a pandemic emergency? You don't bring back masking if the emergency's over. So, yeah, the international one that the WHO ended last week, that one's not over either, despite what the WHO may think it is. Alright, now to this. Following the unexplained death of kindergartner, Detroit Elementary School reopens amid the cluster of mystery illness. So remember, last week we were telling you about a child care center, and I believe it was an elementary school last week, and there was actually one person that died. Well, that school is now, yep, surprise, it's reopening. How they can reopen it that fast after one of the students passed away is utterly ridiculous. Now this. Morgan Wallen has canceled 6 weeks of concerts after doctors told him he could permanently damage his voice. Again, that says permanently damage his voice if he does not go out on the sidelines. And it's not saying here, or at least I'm not seeing what the actual issue is that has initially caused that. But here's what he's saying. I'm just going to go ahead and get straight to it. I got some bad news from my doctors at the Vanderbilt Voice Center yesterday, he said. After taking 10 days of vocal rest, I performed 3 shows last weekend in Florida, and by the 3rd one, I felt horrible, he said. So, that's not good. And it sounds like he is diagnosed with vocal fold trauma. That's something I've honestly never heard of. So, who knows? I also question this. Did he have a previous COVID infection? I don't know, but we have heard voices change after a COVID infection. Alright, now to this. This is something local to my area, but I got a feeling it's happening in the rest of the country as well. Strep throat is making a comeback in Philly after pandemic lows. Strep throat is fairly common among school-age kids, but cases dropped during the pandemic. Hey, everything dropped at the start of the pandemic. People wore social distancing, staying safer at home. People wore masking back then. And now we're starting to see all these things from the past come back, such as strep throat, and I believe there was a huge wave of strep throat back in the fall of last year, if I remember correctly. So yes, strep throat cases are going back up here locally. And let's see this. In Philadelphia, Dr. Dan Taylor is a pediatrician at St. Christopher's Hospital for Children, said cases have been continuously high this winter and spring. And it also says here, strep is very predictable. Typically, Taylor said, what we haven't predicted in 2023 is, at least anecdotally, a doubling of strep infections that we're seeing here. It's an everyday occurrence multiple times a day. You got to understand something. We're coming into the warmer months now. A lot of these viruses are most transmissible in the winter months. So this is not normal to see this happening. But again, there's no immunity because back in 2020, everyone stayed at home. Plus, we know COVID itself damages the immune system. All right, I don't like to talk about politics on the channel at all, but this is something that must be said. George Santos took unemployment for a year during the COVID pandemic despite having a $120,000 a year job at an investment firm, feds say. So he was collecting unemployment, money that people desperately needed. We've seen some data recently showing how bad the job situation was at the start of the pandemic. You know how bad the food lines were. There were people lined up in their cars or going around blocks and blocks to get free food because they weren't essential employees and they weren't allowed to go to work. And meanwhile, this person who was collecting $120,000 a year paid job was collecting unemployment. George Santos is just an utter disgrace, and the fact that he represents us, he's a politician, that makes it even more of a disgrace. All right, this is just silly. It's kind of a sign of the times. Sorry if you don't agree with this. CNN has been on a downward trend. CNN's just been awful, and we're not going to read the whole article. I'll link the article. I'll tweet the article, but I just want you to read how they titled this. This just sounds awful. Dr. Sanjay, the COVID-19 emergency is ending. It's time for the patient to leave the hospital. So the emergency is going to end tomorrow. The patient's just going to walk up and walk out of the hospital. Hey, the emergency ended. I'm all better now. No, it doesn't work like that. What a stupid headline. All right, moving on to this. As you heard yesterday, in case you didn't see yesterday's update, Walgreens COVID positivity tracker is back on a weekly basis. It's going to be updating on Mondays. The number this week was 24.8% positivity. Prior update, it says prior week, but we don't actually know when that update was 19.4%. It rose this week by 5.4% because testing was down. All right, we do have a couple things on this day in pandemic history. On May 10th of 2021, the FDA expands emergency use authorization, EUA, for the Pfizer-BioNTech COVID-19 vaccine to include all adolescents from ages 12 through 15 years old. Also on this day of 2022, last year, during the COVID-19 pandemic, there has been a 35% increase in the firearm homicide rate, resulting in the highest firearm homicide rate in more than 25 years. Firearm homicide rates are the highest among males, adolescents, young adults, and non-Hispanic, Black and non-Hispanic, American Indian, and Alaska Native people. Rates of firearm suicides remain high, increasing most notably among American Indian and Alaskan Native males ages 10 through 44 and are highest in rural areas. Yes, there is a huge problem with gun violence in this country, and unfortunately, that's not getting better. It's been getting bad for a very long time, and it's something that also needs to be dealt with, just like this pandemic does as well. Taking a look here at the National Wastewater, let's refresh this to make sure it's up to date, because sometimes they give me a surprise update in the middle of the week or later in the day when I least expect it. Taking a look here, yeah, nothing has changed. Still dropping in the West Coast and flat to ever so slightly rising in the rest of the regions. We'll call it flat. Taking a look here at the CDC map, nothing has changed today. Sometimes it can update as late as 8 p.m. Hopefully this continues to update after tomorrow. What we will lose tomorrow is this. We're going to lose the transmission map tomorrow. I don't know if it's going to give one last final hurrah update tomorrow. Doubtful. But let's just run through it anyhow. High transmission, 557 counties. Substantial, 354 counties. Moderate, 1,437 counties. Low, 775 counties. Taking a look at the latest variant proportions, as you know, XBB.1.5 is the dominating variant at 66.9%, XBB.1.16 at 12.5%, XBB.1.91 at 9.4%, XBB.1.92 at 3.7%, XBB.2.3 at 2.7%, XBB.1.5.1 at 2.4%, and FD.2 at 1.6%. New Jersey for today had another 157 cases, 144 probable cases, and they did add 2 deaths today. So as long as there are deaths, in my opinion, the pandemic is not over. Taking a look at the latest hospitalizations in New Jersey, which also indicates the pandemic's not over. Now, I will tell you this. They've been trending in the correct direction, which is downward, but there's still 161 people hospitalized in New Jersey, 6 people on a ventilator for COVID, 20 people are in the ICU. Taking a look at my city, Philadelphia. Here's the EMS calls for the last 24 hours on Tuesday, May 9th. 760 EMS incidents were recorded. Taking a look at Center County, Pennsylvania, their only hospital, which is Mount Nittany Medical Center, they added 2 hospitalizations today, so just 2 people in the hospital. That is a drop from 5 yesterday. Taking a look at New York State, 441 people have tested positive in the last 24 hours, not including reinfections, not including at-home tests. 1.7% positivity, and 1.9% is the 7-day average. Hospitalizations in New York State are as follows. 575 people are in the hospital. 62 people are in the ICU. Taking a look at New York City, you'll see here, New York City dropped ever so slightly today. 178 people hospitalized, 24 people in the ICU. So we are still not seeing an increase in New York State yet, caused by the XBB.1.16 variant. At some point, we do anticipate it's going to happen, and who knows how big this wave is going to get. It's been a long time since we've seen a surge now. A lot of people have not had the booster shot as well, so immunity is starting to run pretty thin in a lot of people, and that's giving the XBB.1.16 and even XBB.2.3 some breathing room to really take off when it gets to a certain percentage. So we'll have to see what happens. Alrighty, that does it for today's pandemic update. I will join you again tomorrow for another pandemic update, and just because the pandemic emergency is ending tomorrow does not mean we are ending our videos. They are staying as long as there are still COVID cases about, and any other virus out there. We cover lots of different topics. H5N1, monkeypox. Today you heard about strep throat. You'll hear about flu cases from time to time. Anything that impacts your health, we talk about it here on this channel. If you like this video, give it a thumbs up. If you want to see more content like this, hit that subscribe button down below. I will see you all again next time, but until I see you again next time, which will be tomorrow, stay safe everyone, and thanks for watching.